here I am, Cecilia Jimenez-Damary, the UN Special Rapporteur on the Human Rights of Internally Displaced Persons, welcoming you once again to the video series on the guiding principles on internal displacement, why and how they matter. In the previous video, we started the discussion of economic and social cultural rights as part of the protection during displacement when it comes to the rights of internally displaced persons. And this is Principle 18 on the right to an adequate standard of living. And in this video, we will discuss another important social right, which is the right to health. I suggest you have a copy of the guiding principles with you at hand. So what does Principle 19 say? Paragraph 1 provides that all wounded and sick, internally displaced persons, as well as those with disabilities, shall receive to the fullest extent practicable and with the least possible delay the medical care and attention they require, without distinction on any grounds other than the medical ones. When necessary, internally displaced persons shall have access to psychological and social services. This whole paragraph in the principle deals with the overall notion of the right to health as they apply to internally displaced persons. It makes special mention of persons with disabilities who are usually much more vulnerable than the rest of the displaced populations in the context of internal displacement. It is for this reason, actually, that I dedicated my 2020 report to the United Nations Human Rights Council on the rights of displaced persons with disabilities, which explores their rights as IDPs and the responsibilities of states and other actors for their specific protection. The last sentence of this paragraph brings to the fore psychological and social services as part of the right to health, particularly because of the distressing conditions of internal displacement. It is a recognition to highlight the much-needed protection of the mental health of internally displaced persons. Paragraph 2 provides that special attention should be paid to the health needs of women, including access to female health care providers and services, such as reproductive health and appropriate counseling for victims of sexual abuse and other abuses. Women, because of the nature of their own biological makeup, are in need of special attention in terms of protection of their health needs. Human Rights Treaty law actually explicitly provides that such approach is necessary to attain the elimination of discrimination against women. It is also important to note that this paragraph provides for appropriate counseling when it comes to gender-based abuses and violence directed towards women. Last but not the least is paragraph 3. It says, special attention should be given to the prevention of contagious and infectious diseases, including AIDS, among internally displaced persons. And medical care, therefore, includes special attention to prevention of contagious and infectious diseases, which can even actually spread among internally displaced persons, particularly in crowded places where they live, such as camps and human settlements. This situation is not only with regard to the spread of AIDS, of course, but other diseases as well, such as the COVID virus that the world is suffering from right now. As far as internally displaced persons are concerned, more attention should be given to them to prevent the spread of the pandemic and to treat those who have acquired the virus. It is also for this reason that humanitarian actors such as us are actually advocating for vaccine access, which is an important element for prevention. Much indeed remains to be done. Thank you for tuning in. And in the next video, we will turn our attention to Principle 20 on the right to recognition before the law. I will see you then.